we go. Yay. All right. Well, thank you so much for letting me share our resources with you. My name is Dawn Guerrero. I'm the Patient and Community Outreach Manager with the Leukemia and Lymphoma Society. And so my role is to provide resources to patients. And my territory is Colorado, Utah, Wyoming, and Idaho. Big territory. For those of you who don't know a lot about the Leukemia and Lymphoma Society, we were started by a family whose son had leukemia back in the 40s. And as you know, back then, leukemia wasn't survivable, but they decided to dedicate their lives to curing cancer. And so today we have three pillars to our mission. We fund research because we want to cure cancer. And of course, we drive advocacy because it doesn't do us any good to create a treatment that no one can afford or cannot access. And if you'd like to get involved on the advocacy side, I can give you some more information about that. And then my side is the support side. We're not just looking at the future, we're looking at today. We want to be able to provide support for patients and their families while they're undergoing treatment. This is how you can help. Our referral form. It comes in both paper format that can be faxed in or emailed in, but it also comes on our website. You can fill it out there. It takes 2 minutes. And what I suggest, I'm going to spend 30 minutes. Is that right? 30 minutes going over resources. And it's not all of them. And it can be a little overwhelming. I know that as healthcare providers that you guys don't have 30 minutes to talk about nothing but LLS. And so this is the great way to connect every single patient that you have with us so that they can hear about those resources. And what I suggest saying for your HIPAA is just, you've been diagnosed with a blood cancer. The Leukemia and Lymphoma Society has a ton of resources. Can I have someone reach out to you? And as you can see, it's just contact information and their diagnosis, and you sign the bottom. If there's something in particular that you're looking for in your conversation with them, you can add that under additional comments. This is you know what? I'm going to skip this. Sorry. When you send in that referral form, it within 24 to 48 hours, one of our master's level nurses or social workers who are oncology trained will reach out to the patient and just have an initial conversation with them about all of the different resources that we have. Many of them also speak Spanish. And we also have a language line if there's any other language that needs to be brought into the conversation. You guys can use these as well, by the way. So if you have someone who you're having trouble connecting with, you can give us a call and we can get a language person on the line for you, a translator to help you with the conversation. And it's free. The Information Resource Center is also our gateway to our Clinical Trial Support Center. And we recognize that a lot of hospitals have their own Clinical Trial Support Center, but ours is focused just on blood cancer. That's all they do. So they truly are experts in this field. We have a contract with ASH. So if your cancer center doesn't have a support group, a clinical trial center, they request through ASH, it's coming to us. So we are the official clinical trial support center for hematology oncology. Their real purpose, though, is just to educate. But if someone does want to apply for a clinical trial, they will help them to apply and actually overcome obstacles. They don't leave them to do that on their own. So that's really cool as well. I would be very neglectful if I didn't mention financial assistance, because we know that's usually the most urgent of needs with patients. And we have quite a few that generally open and close periodically, like a nice roller coaster ride that we all know throughout the year. And we have everything from travel assistance. Sometimes in the areas we have local financial assistance that's based on where the patient lives. We also now have scholarships for blood cancer patients. If you're 26 or younger when you were diagnosed, you can apply for that. And the past 2 years, we provided over $7,500 scholarships for patients. And that was really impactful. Also, we have urgent need. Urgent need is a $500 grant that can be applied for every 12 months. That one is the only one that you have to apply for the patient. The patient cannot apply for them. So if you were looking for something that only you can do versus the patient being able to do it on their own, that's the one where we're going to need your help. Now, copay assistance is anywhere from $5,000 to $13,000 and can be applied every 12 months. There are, by the way, if you're on this call, there are multiple silos available. If you're on my list, my email list, then you probably got an email on Monday telling you that a bunch of the silos opened up, and another one opened up yesterday. So check it out, get in there quickly, because as you guys know, these silos open and close pretty quickly. But the copay assistance can be used to pay for their insurance premiums, scans, labs, medications, any copays they have that are cancer treatment related or supportive. Our portal, there are two different ways that patients or you can apply for financial assistance for a patient. And that is to call in the application to that 877 number on the screen, or you can go to our portal, create a profile, and then apply for whatever financial assistance you want. The other nice thing about our portal now, if you haven't used it in a while, is that you can actually check on all of your patients' statuses in the portal right here. That's really neat. So some of our support systems, and these are my favorite apps. This one's actually my absolute favorite. Patty Robinson Kaufman First Connection Program. It's a mouthful, but it's basically a peer-to-peer support mentorship. And what we do is match a patient with someone of similar diagnosis, age, sex. We can even get into, are they married or not married? How many, kids at home? Sometimes it's not really about the treatment, but it's about lifestyle. I'll give you some examples. I'm a marathon runner, and am I ever going to be able to run again? Or it could be I'm a single mom of 3 who is about to undergo stem cell transplant, and they just want to know how in the world they're going to handle this at home. Or it could be diagnosis related. Hey, I'm newly diagnosed and I have no idea what to expect. Oh goodness. Or even something simple like with CLL, where you're diagnosed and then told that they're not going to do anything about it. They're just going to watch it. That can be very scary for a patient. And so to be able to talk to someone who has had CLL for 15 or 20 years can be very calming. And in the case of something like AML, I think it improves outcomes, because if you have a 30% survival rate, but you can talk to someone who went through the treatment and survived on the other end, it certainly changes your outlook on life. The other support resources that we have are, we have an online chat. So this is done in real time, at least once a week. Several online chats open up at different times for a couple hours, where a patient can go in and chat with other patients across the United States. These are all monitored by the master level nurses and social workers for accuracy. We also have family support groups. And if you're interested in starting a support group in your area and you'd like LLS's support on that, I do have a budget. I have administrative help. We could be your administrative arm, doing reminders, helping you on the back end. And that way, all you have to do is work the meeting. We do that with the Colorado General Support Group that runs the fourth Monday of the month and is virtual. So I can get you a flyer for that if you'd like to share that with your patients. We also have our LLS community is an online social media platform that is it's private. There are no ads. All of the chat rooms are monitored by those same master's level nurses and social workers for accuracy so that we don't have crazy things being said in there. So we're really proud of this. I think there's about 15,000 blood cancer patients in there utilizing the services. So it's a great way to connect with others across the United States and rest assured that you're not getting wrong information. We also provide caregiver support. And, caregivers sometimes get lost in the shuffle. We want to make sure we give them as much help as we can. This caregiver workbook is mailed to any caregiver that calls our 800 number, that 800-955-4572. And it has everything. It's great. I mean, it does come with a journal and a pen and a pill box. But inside the workbook, there are things like how to create a budget. How do I apply for Social Security, or how do I apply for Medicaid? What happens if I'm denied? What are some nutritional guidelines that we should be following? What questions should I be asking my doctor? And then self-care stuff, how to manage stress. There's all kinds of great stuff in there. So I love this workbook. Oh, we are going to skip anyone on here with pediatric. No. Okay. We're going to skip the pediatric stuff. Okay. We also do education programs, and we do them both. You will notice we are the #1 provider of educational materials for any blood cancer. And we try to hit all learning styles. We do in-person education programs. In fact, in Denver, we will be holding our blood cancer conference on April 6th. So save that date. Hope everyone can make it. Come on out as soon as the website is up and running. Our agenda is fixed now, and we're in the process of building the website. So hopefully by February 1st, I'll start sharing flyers and the website with you guys so you can register. But we also do other educational programs. We do webcasts so that people who don't feel comfortable coming out in person can do that. We also do one blood cancer conference virtually a year, and that's done in the fall. So we'll do the in-person in the spring, and in September, we'll do one virtually. We do podcasts, and here's some of the topics that are available. These topics come out every 2 weeks and they're on all the major streaming platforms or can be downloaded straight from our website. We have blogs. We also have our wonderful educational booklets. Love these. Check some of these out. I know that these can be a little overwhelming because there's so much material there. And if we're visiting your cancer center, then I hope that we're bringing by, or either myself or one of my community outreach volunteers bring by some new materials every couple of months, just so that you can see what else is out there. Here's some more educational materials, fact sheets. They have a whole series on side effect management, in fact. We also have dietitians on staff that do free nutrition consultations. They're 30-minute consultations done over the phone and then followed up by email. They are free. They are actually free for any cancer diagnosis. So that's wonderful too. And it can be something as simple as I just want to be healthier, or it can be specific needs. We don't care. I love the Health Manager app. I know I'm going down rabbit holes here, but oh my goodness, the it has my favorite thing is that it has a side effects tracker where the patient can keep track on a daily basis of their side effects and then share those. They can actually pull the report and email it to their doctor or their nurse to share. We all know how they show up in the office and they think they're going to remember what side effects they had or what the severity was, and the reality is that they get into the office and what do they say? You ask, "How are you doing?" and they say, "Fine." So this is a great way to help. We also do free CEs and CMEs on our website. And the website is lls.org/CE for free continuing education classes. So if you need some of those, you can get that right there. There's some of the topics that are available. And then there's also a podcast for professionals. So this is a great way for you if you're new to the field or if you want to learn more about each of the different diagnoses, you can actually join and listen to some of the podcasts. And this is, of course, on a deeper level of understanding, meant for healthcare providers versus, or even general practitioners versus patients. I love the 3D model library. This website, we have over 19 different interactive 3D models now so that you can, if you're trying to explain something to a patient and you're struggling to, you can send this to them or you can pull it up real quick and show them how it works. You know, hey, I don't understand what you're going to do when you do that lumbar puncture or the lymph node aspiration. You can go right here and show them how it works. And, I just talked about a lot of things, and I'm not touching on every single one, but I know that you don't have the time to share all this with a patient. I get that. So let us be your right hand and let us help you. One of the nice things after that initial phone call conversation with um, our information resource center and those master's level nurses and social workers, after they have a conversation, then about 2 to 3 weeks later, we have local volunteers that reach out again and have additional conversations. They gives them patient time to digest, to think of questions, maybe figure out what they really need or want. And we also try to put them in touch with the support groups. And we share not just our resources, guys, we share everyone's resources. If I know about it, my team will let them know. We can't do any mass emails, but I can share on an individual basis. So I think I saw some questions in the chat, but I wasn't sure. I couldn't read them while I was doing this.
That was great. I feel like you have way more from my years ago in pediatric oncology. There's like way more happening even now.
There's so much happening, and new stuff pops up every month. It's hard to keep up with it. I get it. And so if I'm not in touch with you, please reach out and I'm happy to share with you guys on a individual basis based on needs.
And one of our questions is, are these resources, specifically the financial assistance programs, available for undocumented or uninsured patients?
So the patient, as far as financial assistance, the one that's called Patient Aid, which is $100 grant, it's just 100, but that one doesn't have any financial restrictions, so it doesn't require a social security number. And because of that, it can be used for anyone, undocumented, and every single blood cancer patient gets that regardless of their financial situation or diagnosis. The others require some financial verifications, and so those undocumented can't get. But the undocumented can also get the support groups, the patient education programs, and we do some in Spanish as well. They can also get a peer-to-peer support program, peer-to-peer mentor in Spanish. So we have several different languages we can do that. What else? Awesome.
I know you mentioned Spanish speaking a couple times, but all of those like educational booklets and the caregiver handbook, is that also in Spanish?
Everything.
Okay.
Everything we have
Awesome.
is in Spanish and in English, and you can actually even switch our website to Spanish.
Oh, wow. That's great.
Thanks for asking that. I'd forgotten to say that.
Does anyone else have any more questions? You can jump in or put them in the chat.
I'll put, once we switch, I'll put the link to the referral form on the online referral form in the chat. And if you want later, I can share the paper one that you can print. How's that?
That's great. And Carlin is going to share some of those resources in the Timely Task Force update that goes out over email or
Okay. So I'll just send it.
Newsletter.
Okay, I'll send it to you guys. Great. Thank you so much for letting me share our resources. Sorry,
Thank you
it's
so
really
much, Dawn. We really
suddenly-
appreciate
Thank you,
it.
Dawn.
Suddenly really bright.
Okay, Karen, it's all yours.
Yeah, cool. So we just wanted to save some time to just talk about what's coming up in the new year and different projects that are happening. And so I just wanted to take a couple minutes to talk about some of the things happening on the CDPHE side of things. So I work on the Comprehensive Cancer Control Program. So we work on cancer prevention, access to early detection and screening, and survivorship care. In terms of survivorship, I just wanted to share the things that we're working on. One is also kind of a request for input and help if possible. We are working on trying to create an educational brief or flyer that we can share with providers about survivorship care. I think we probably all know that there's a little bit of a gap when people finish their treatment and are going back to a primary care provider who isn't as well versed in cancer care. And so I've been working on creating a document that we could share with providers, but would love to get input from other people and figure that we've got a lot of experts here, or people who have a lot of experience working with survivors. So I just wanted to plug, if anybody has interest or capacity at all to take a look at a document and provide any feedback, if you could please send me an email, and I'll put my email in the chat. Yeah, I think primarily primary care providers. I wouldn't say I'm limiting it, it could be like nurse practitioners, PAs, whoever. But I think then you will try to get it in an email out to the Colorado Academy of Family Physicians as one way of dissemination, and then figure out how else to get it out there to the people who are providing this care. But so far, trying to include like symptoms to be on the lookout for, mental health screening, like late, I guess with symptoms like late term effects or toxicities that can happen depending on what treatment a person had, and then just like exercise and nutrition input. So trying to take a holistic approach to this. So yeah, I'll put my email in the chat when I'm done talking. And if anybody is interested or has recommendations of somebody that I could reach out to get input, I'd really appreciate any ideas on that. And then just briefly, I want to fill people in on the other two things that we're working on our team. One is trying to get a survey out to different cancer centers, primarily community cancer centers, to learn about what they are offering in terms of survivorship care. This is really rooted in the Commission on Cancer requirements for survivorship for cancer centers to maintain their accreditation. And so we're working on creating a survey and getting that out to the cancer centers to find out what they're currently offering and if they need any support to like improve those offerings and maintain accreditation by the Commission on Cancer. And then the last thing, and then I'll answer your question, Dan. The last project is we're starting a new partnership, kind of in progress of the contracting right now, but hopefully getting mental health providers trained in psycho-oncology. This is based on feedback that we've heard about how valuable it is to have a mental health provider who is well-versed in oncology, working with cancer patients. And so we are going to be helping connect mental health providers to a psycho-oncology training. And then having those providers work with Ray of Hope Cancer Foundation and their mental health support grant program. And that will really place an emphasis on any bilingual mental health providers. I was gonna say, yeah, bilingual. And then, yeah, so just trying to increase the number of oncology trained providers for people in Colorado, but especially those who are Spanish speaking. So again, if you have any recommendations on mental health providers, especially Spanish speaking ones that might be interested in this, if you could shoot me an email. And Dan asked about if there's going to be resources for patients in that brief. And yeah, currently I've got, I had a link to the coalition website where they've got all of the resources. So it would either be just like a QR code or a hyperlink that somebody could click on and be connected over to a comprehensive list of that. And I'm trying to remember if I also included the resource map that I know Carlos worked on. That's really great to share too. So yeah, my goal is to also be able to share kind of like hubs of resources that providers could then share with their patients. That was a lot. So does anybody have any questions or thoughts? Okay, well, if anything comes up, yeah, you can reach out to me at any point. And also just wanted to give space, yeah, as we go into 2024, if anybody else is working on any sort of survivorship or palliative care projects or are interested in doing something in the community to improve, access or quality of those services, if you're open to sharing, we'd love to, be a venue for brainstorming and working on these things.
Okay, I think now we want to give everybody a chance to share what you've got going on in the new year if you want to. Allie, I was hoping maybe you could start with a brief update on what's going on with the coalition, and then people can either jump on in or raise hands and we can go from there.
Yeah, I'm happy to do that. Can you hear me? Okay. So I don't think I have met all of you. I'm happy you guys changed your meeting time because I'm able to join more of these meetings. So for those of you that don't know me, I'm Allie Bain. I'm Associate Director of State Partnerships with the American Cancer Society, and also am a part of the Leadership Advisory Board for the Coalition. So I'm sure that you guys have seen some of the emails that the coalition is kind of in transition right now. So right now, our main goal as a leadership board is to reestablish a fiscal agent. So when Corey departed, we were kind of in between fiscal agents. And so right now we're making an effort to repair the relationship with Trailhead Institute for them to become either a temporary fiscal agent for us while we determine what a more permanent solution is, or move back to them as kind of our permanent fiscal agent. So we're in the process of that. Our main priority is making sure that the task forces continue to operate. Certainly that is how the work of the coalition gets done. And so we're trying to ensure that everything all of you need in order to complete the work of the task forces is readily available, and to address any concerns or challenges that you have. So as we get more information and as we move forward with the relationship with Trailhead, we'll keep everybody updated. And in the meantime, if you have any questions, you can let me or Ian know.
Thank you. So would anybody like to start and give us an update about what's going on for the year? Okay, Rebecca.
Hi guys. Hope you're staying warm out there. Just I wanted to address something that you asked, Karen, about things that may be offered going into the new year. So my background is I created a psychosocial focused program at Oncology Rehab. It was called ADAPT, and I'm an occupational therapist, but even through that lens, being aware of the very specific concerns someone going through cancer experiences and how it affects their life, their roles, their sense of planning. I addressed that through the program. That's a little bit about my background, but I completed the basic training in a program called Contemplative Psychology, and it's a very compassionate based approach for working with people. And I'm going to continue my studies with the graduate program starting in February, and part of it is going to be a project that I do with the community, and I very much want to address to work with this community in my project. And it's essentially, I mean, you could call it a support group, but there'll be some anchoring practices. Part of what we do is mindfulness, and then that compassionate exchange, speaking from the heart, but also creating a container that a person can take out of the group for themselves as they manage things. And anyway, so I will have details of that going forward. If that is something that you are interested in, providing information for patients, I think I'm probably going to set it up for 8 to 12 weeks, and included in that would be individual meetings. So I'll meet with people one-on-one once or twice in that time, but we'll meet weekly together for 8 to 12 weeks, and it's free for them. So that is all.
Will that be in person or virtual?
I want it to be in person, and lots of questions, but I definitely would like the energetic connections that happen in person, and also the ability to fully utilize that somatic wisdom that we all have, which is a part of what is offered in the training, just a self-awareness of the body. And yep. Thanks.
Thank you, and congratulations on starting your new program. Ian, do you want to update, or Carlo, I see you turn on your camera.
Sure, I can provide an update. Or Ian, go ahead. I don't want to.
Sorry, no, I just finished eating, so I came off here. No update.
No worries. So my update right now for the group is we are starting up. I don't know if I mentioned this last time, but we are starting up our support group for cancer patients and survivors through New Hope Baptist Church. We're basically sponsoring them through the University of Colorado Cancer Center, which, by the way, my name is Carlo. I'm part of the University of Colorado Cancer Center for the Office of Community Outreach and Engagement. We are working with Therapists of Color Collaborative. They're the ones that are providing the support groups for patients, and the main support group facilitator is a breast cancer survivor. So we are hoping to start that support group at the end of this month. We're trying to really gear this support group for the African American population. That's what we're working within the New Hope Baptist Church. But this support group is open to anyone of any type, of any cancer types, of any demographics. So I could pass on the information, the flyer to, I don't know, to Krista or to Carlin. So you can have that available, and you can share it with anyone out, any other partners that you think would be helpful. One thing we are looking for that support group specifically in the future, once it gets up and running, is possibly volunteers that can help provide education or additional support for the support group members, like any nutrition specialists, any sleep specialists for those that are in the cancer field. Those are just a couple of examples. So if you know anyone, or if you're someone that's interested in just giving some extra support to these members and extra education, please let me know. Feel free to reach out to me. I can provide my email, and then we can find a time once this support group gets started, so you can join in and, you know, provide additional information of anything that you provide that could be helpful. For example, if you do like a, you know, support group or a yoga group for cancer survivors or patients, then, you know, that'd be an example of someone that could join the group and give that information. So please let me know if you have any questions about anything, and then if you can provide any assistance. Thank you.
Great. And please send that information to Carlin if you've got her, or to our general email address that I can't tell you off the top of my head right now.
No worries, I can find it. Thank you.
Daniel, do you want to share?
Sure. So I'm Dan Miller with Live by Living. I'm the founder and executive director. We connect cancer survivors and caregivers with nature and one another through walks, hikes, and retreats. Been doing that since 2009. This year we have 8 retreats confirmed, and with the potential for another 3. Our retreats are 3 days, 2 nights. We meet in various locations, a couple of the different YMCA facilities around the state, like the Estes Park Conference Center and Winter Park Snow Mountain Ranch. We also have a camp in Deckers that we're going to use for the first time, trying to expand in the southern region a little bit. And private home in Breckenridge, and then the 10th Mountain Huts. We have a couple retreats lined up there. So first retreat will be in March, a snowshoe retreat, the YMCA. And then I think the next one up is in May. So the retreats are relatively unstructured. Basically, it's an opportunity for people to relax, make friends with people who understand what they've been through, eat some healthy cancer-fighting food, be pampered for a few days, and go hiking in the beautiful Colorado mountains in the foothills. So we also do walks and hikes. Last year, we really expanded our walking program to, I think, 10 different locations. We had pretty good results in a few of those areas, and other places participation was not so great. So we're going to continue to work on increasing participation and certainly spreading the word. Anything you guys can do to help would be great. The walks are typically on a paved surface. They're flat, easy, a mile or 2. Most anybody can do it. And hikes are on trails, typically 3 to 6 miles. And of course, they tend to be a little bit harder than flat walks. And we also have a conditioning program for survivors and caregivers. It's called Cancer to 14K. It's 10 weeks long. It's a hiking-based program. People train to climb Gray's Peak at the end if they're in the more difficult group, and the more intermediate group trains to complete a 14,000 step long walk or hike to an alpine lake. We usually go to Lake Isabel in the Indian Peaks Wilderness. It's about a 6-mile round trip hike. I think Rebecca did that last year. Yeah, so it's a great group. Everything we do is free. Everything is open to survivors and caregivers of any type of cancer.
That's great. And if you want to share some of that, Karin put Carlin's email address in the chat. Anybody else want to give an update?
Krista, I just have one other update from ACS. So some of you might be aware of this and some of you may not be, but ACS launched an app last year for patients. So patients will log into the app and fill out their information, and they'll get personalized resources, and they'll also have an opportunity to connect one-on-one with a trained volunteer to provide support resources for them as well. So it's called ACS Cares. I'll put the link in the chat, but certainly a good resource to share with your patients if they're looking for additional resources, additional connection, or just have questions. Most anything can get answered through the app.
Great, thank you. I don't think I have a whole lot more. Karin, Ian, if you want to.
No, I think also we should have just said the Coalition Symposium. If you want to save the date, it's May 2nd. It will be at CDPHE, so that's just Glendale, like in Denver, basically. Ian or Al, anything to add to that?
The agenda is coming together nicely. We're packing in what we were trying to do in 2 days into 1 day, so it's going to be a lot of stuff, but it'll be really good. And it should be, we haven't settled on a registration price yet, I don't think, but it's going to be much more accessible than was previous.
Great. And if any of you come across people that have something interesting that you think would be beneficial for the task force to hear, we're always looking for speakers. We've got some things planned out already for the year, but we're always flexible if something new or interesting has come up and you think the group would benefit from hearing about it. So I thank everybody for coming, if that kind of covers it, and we appreciate, hopefully we didn't lose people with the date change or with the day and time change, but we appreciate the flexibility.
Thanks, everybody.
Okay.
Thanks, Krista.
Welcome. Happy New Year. Stay warm. Good luck.
All right.
Stay safe.